Don't be sorry, because we on. It's live. Episode number 10 of the Sunday Night Vibe podcast. And we've got a special
Yes.
guest. We'll get to that in just a minute, but there's a little theme running here. A lot of us are happening to be wearing pink. Pink is the color of the month. Pink for breast cancer awareness, of course, October. If you're watching the NFL, everybody's wearing it. If you're walking into Estee Lauder, they're wearing it. Pink is the color for breast cancer awareness. And, it's on and popping. We see it everywhere we go in the month of October, but we don't really, most of us really don't know what's going on with breast cancer awareness. So we got an expert in the house going to help us out. We're going to ask the dumb questions. She's going to laugh at them, and we're going to get some answers. So, am I right, Nadia?
Yes, right? Okay, so yes, without further ado, because I believe we kept y'all on hold for a long time. So tonight, our special guest has nationally and internationally influenced, educated, and coached the importance of holistic wellness on the platform of wellness. Platform of her wellness blog called Returning to Nature. As the owner of Mind, Body, Spirit Wellness Center, she uses her Atlanta, Georgia-based practice as a means of providing high-quality, customized care to those seeking more natural, integrative medicine therapies. So tonight we have Dr. Kat.
I love
Ida
it.
Phillips. Yes, Dr. K for short. How are you tonight?
I'm fine. Thank you for having me on tonight.
We are delighted. We are here and we're trying to get to the bottom of this breast cancer awareness month and all that jazz. So could you tell us a little bit more about yourself? And I know a little bit more because I've, studying the whole holistic, healthcare and all that stuff. So could you tell us a little bit more about that?
Yeah. So I basically like to inspire, educate, and empower people on how they can be in charge of their own health and how you can use natural tools like tools from the earth or tools without side effects or that are not invasive like surgeries to actually enhance your wellness, how to use your own lifestyle to enhance your wellness and prevent disease. And then the whole holistic comes in with balancing the whole person, not just the physical health, but your mental health, your spiritual health, emotional health, and then making sure all levels are covered and equally balanced. So that's in a nutshell what I do for people through speaking engagements, webinars, workshops, lectures. But then for people who want actual physical treatment under that philosophy of wellness, they can come to my practice, and which is called Mind, Body, Spirit Wellness Center. And you can receive actual therapies that are natural, acupuncture or vitamin IV cocktails, infrared saunas, things like that.
And I am dying to try that. Dying to try that. I really
That's up my alley. I love it.
Yeah.
Well, I don't know. What is an infrared sauna? That sounds, I don't know. What is that?
Uh-oh. There we go.
Oh, okay. I don't know what
Did we
happened.
lose you, Kat? Are you gone? Did you disappear on us?
I'm here.
Okay, so I was asking, you mentioned a red beam sauna.
Infrared.
Infrared.
Yeah, one of those. What is an infrared sauna?
Yeah. So far infrared technology is basically, and you mentioned the red beam, so I guess you're familiar with what it looks like. But
No.
Okay.
No, he's not.
I just assumed there was a beam involved.
Oh.
That was a coincidence.
Okay. Well, it's another mechanism of reducing inflammation in the body, so helping to enhance circulation and pull toxins from the bloodstream. through a light beam. And it's usually a red light beam. Yeah.
Okay.
Pretty
Okay.
cool. That's pretty
All right.
cool.
That sounds healthy. So you're with your practice, you know, with doctors these days, there's a lot of concern with over prescribing of medicine, and in some cases addiction to medicine and all that. So you find ways to treat without heavy medication?
Right, exactly. So a lot of people will come to me to actually get off of medication.
Oh.
So I help them to get off of the drugs and lean on something more natural, and then help to adjust their lifestyle in the meantime so that their body can operate on its own. Because we were all designed originally to heal on our own.
Mm-hmm.
Like very resilient creatures, we can heal on our own if we remove the obstacles that we've put in the way of our body being able to do this. So a lot of times, a lot of the chemicals we're put on, aka drugs, are a little toxic for the body. Majority of drugs were designed originally only for temporary use. So they're designed for you to get on them so that to buy you time to clean up your lifestyle to then get off of them. But what happens is people end up using it as a clutch, and they're on the blood pressure meds or the diabetes meds or the cholesterol meds for years and years and years.
Yes.
And that's what we don't want to see.
Okay. Let's talk a little bit about breast cancer. I'm reading statistics from breastcancer.org here, where it says 1 in 8 U.S. women will develop invasive breast cancer over the course of their lifetime. In 2018, an estimated 266,000 new cases of invasive breast cancer are expected to be diagnosed, along with 63,000 new cases of non-invasive breast cancer. So I am very ignorant to breast cancer. Is this a hereditary disease? How does one get breast cancer?
Well, I think the even better question is, how does one get cancer, period?
Right.
Okay.
We celebrate breast cancer because we're in October, but there are so many different kinds of cancer. There are not enough months in the year for each one to have its own name. Basically, how you get cancer is, in a nutshell, in the same arena. And then depending on what part of the body is most inflamed or toxic, we label it as that kind of cancer. So there are some hereditary components, which are more of like patterns that we've noticed that, if mom and daughter and grandmother have these certain genes or certain patterns, we've noticed that kind of a link. But it's not to say that because your mom has breast cancer, you will then have breast cancer.
Right.
Okay.
More and more research pop up that's showing that lifestyle is actually just as important as genetics, if not more so. And lifestyle your way out of the path of cancer, or the opposite, you can lifestyle your way into the path of cancer.
Right.
One in your family to have it. So I'm seeing more and more people like coming into the wellness center who are breast cancer, no one else had it in their family. Lung cancer, no one else had it in their family. And it's just like, why me? Then we look at the lifestyle. So lifestyle for me is the major component of why we are getting such a buildup of inflammation in our body, which is looking on these cancers, autoimmune switches, all of these different chronic diseases, because we're just overloading ourselves with toxin and stress, and we're not sleeping, and our diet is horrific, and we're not moving. These are what I mean by lifestyle. It's not just the food. So this is pretty much what I teach on all the time to help prevent getting into the cancer category at all. So instead of really focusing on how do I prevent cancer, I have people focus on how do I promote wellness. and it's more of wellness awareness than cancer awareness.
Oh.
Yeah.
Okay.
So what are the foundations for the wellness that you speak of? I've heard of food. I heard sleeping. What are the foundations that we should be focusing on?
Great question. So I basically teach on 5 pillars of the lifestyle. And then they're all equal. So this is not in any order of priority. But number 1 would be diet. So this is anything that you consume, whether it's a food or a beverage, even supplements. Like you're consuming it, it's in the diet category. Number 2 would be rest, not to be confused with sleep. Sleep is encompassed in there. So sleep/rest. Number 3, physical activity. Like how are you moving? Number 4 would be stress management. How are you responding to stressful stimuli in your life? Number 5 would be toxin reduction or toxin exposure reduction. Like how are we removing the things that are going into our body and causing these weird chemical reactions to occur, or things we're touching or rubbing on our skin or putting in our hair, or cosmetics that we're using that are actually acting like estrogen in our body and causing these estrogenic conditions like breast cancer and fibroids and stuff to be on the rise. So those are the 5 legs that I actually help to clean up. I hack. A lot of people call me a lifestyle hacker. I'll hack those 5 areas. And usually people are good after stabilizing those 5 areas. I don't even get to the therapy and the supplements part. And there's symptoms, disease, or just disappear. Yeah. So
well, let me ask you this, Kat, because I hear this so much. Me being a vegetarian, and I know you're a vegan, so you know the hardships of that, and you probably are like, it's not as hard as people make it out to be. Just like I tell people the same thing, it's not as hard as it looks. But with, like, for example, eating foods like what is it, like soy, for example. With that, because that's something I kind of stay away from. I was, doing some type of research, and I learned how different countries stay away from soy and all its, other things. But yet in the US, we, it's in everything, So it's like, with that being said, it's like, is that one of the things that could cause like inflammation, that could possibly lead to cancer? And I'm not even going to say breast cancer, but just cancer, altogether.
Yeah, so it's funny you mentioned that, because that's actually an example of one of the things I was just talking about, that when it goes into your body, it acts like estrogen and mimics estrogen.
Okay.
So we have different names for these, like phytoestrogens and xenoestrogens, that are not the actual estrogen hormone. Go in and act on the estrogen receptors very similarly. So the way that soy is processed in this country is part of the problem, or the main problem. So a lot of times the soy will go in and act like estrogen. And then the other part of the coin, the flip side, is that now about 90% of our soy is genetically modified anyway. So once you get over the whole estrogen hump, you have to deal with the fact that most of our food in the United States is genetically altered. So that has its own whole problems in and of itself. And now we're having this surge of veganism and vegetarian.
Yes.
And we're seeing more soy-based products and soy-based meats and soy-based, everything is soy. And that's why this is relevant now, is because we don't have so many vegans and vegetarians.
Right.
And now it's a thing. People are switching to soy milk from, the cow's milk. People are eating these meat substitutes, the vegan bacon, the vegan chicken nuggets, and all of that. Really being cautious to read the back and see, is this a soy product, or is this a mushroom product, or a plant-based? You can get different kinds of plant compositions that are not soy all the time.
Right. Yeah, I noticed that.
this is all derivatives of soy. So it could be soy sauce, it could be edamame, it could be tofu, it could be, like I said, soy milk. So all of the derivatives, yeah.
That is unbelievable. Okay.
Well, let me ask you this. So with cancer and how it interacts, if we're specifically looking at breast cancer, why do women get it but men still do? I know you said it's based on the inflammation. How does that work with the different genders?
Oh yeah, so no one is safe. Both genders can get breast cancer. The guys get it at a much less rate than us. I think it's even somewhere below 5%, like between 1% and 3%, I think, the male percentile. It's basically body composition, fatty tissue, all of that play into it, like our anatomies. But men can certainly get breast cancer. I know breast cancer is like climbing as far as like when we rank the prevalence of cancers, it didn't used to always be like at the top. But now, especially for us, for women, it's like second, number 2, skin cancer. So it's rising fast. And I know for you guys, like the men, we have to worry more about like the prostate cancers and things like that. That's
right
on the chart. So it's like each gender has their poison to pick. But yeah,
right.
Both men and women can get breast cancer, definitely.
And I know you say with the wellness, your diet and all that will help possibly stop you from getting the cancer or putting you in that cancer lane. But for those who have actually, they didn't go that path and they actually have cancer, by changing your diet and your sleeping or resting patterns, not just sleeping patterns and all that, is there a way to reverse that and get out of that cancer once you've already entered that lane? Or is it all medicine from there?
No, that's not. You always have options. You always have options with your lifestyle. Changing up your lifestyle while you have cancer will severely impact the fight in your favor, like severely. And, I don't want to put out claims like cure and totally,
right.
But it will severe. So my cancer protocols, the first thing we do is clean up the diet. That's the first thing we do. So, one of the things that cancer, just in general, different cancers respond to different things, but just cancer in general, the cancer cells really have a high affinity to sugar. So if you want to talk about what's feeding the cells, the sugar is a huge component. And what I do, the first thing, remove the sugar from the diet and essentially help to try to starve out the cancer cells. That was just something that I was confronted by in conventional medicine. I was in a facility where they were administering, chemo and radiation, and they had someone walking through with a cart of like Snickers and Twix and chips and sodas and, letting the patients snack they wanted. And I was just like, wow, we are like simultaneously feeding and trying to kill the cells at the same time. So diet does play a tremendously huge part in your fight. So what I'm talking about, the 5 pillars, will impact whether you are someone who's never had cancer before in your life and you just have no desire to ever have it. It will impact those who are currently in the middle of a cancer fight right now. And it'll impact those who were, in the past in a cancer fight. They may be in remission. Are still not completely safe. You still don't want it to come back because that happens as well. So this is great for all 3 types of people. And really understanding this lifestyle component, like those who really truly get it are able to basically will themselves out of pretty much any disease, including cancer, depending on how invested you are to the process, how strict you are about the process, how serious you are about the lifestyle changes.
Right.
from a scientific perspective, the way this works, for instance, with breast cancer, all breast cancers are not the same. So that's something a lot of people don't understand. Like, why did this person die immediately, and why is this person okay for 20 years? Like, they're not all the same. Some are more aggressive than others.
So it doesn't only matter if it's stage 1 to stage 5.
Right. Oh, yeah, it's much deeper than that. So going back to the estrogen receptors I talked about before, you have some types of breast cancer that are, we call them negative estrogen receptors or positive estrogen receptors. So the ones that are negative or positive basically let us know how much they'll be impacted by hormonal treatment, which is usually the conventional treatment. So those that are negative usually are not very responsive to treatment and are usually more aggressive. This is not something that you would know, you just know that you have cancer. The doctor is going to sit with you and explain this to you, why the drugs are not working for you that may have worked for your friend or your mom or your sister. So we're seeing a rise in the ones that are not responding. And what they've noticed in research, like a lot of research has been done to look into this, research on, I think it's mainly mice so far. They haven't done any human studies, but they've seen that there are 2 chemical components that actually help to bump you from one category to the other, to help you to be more treatable. About the negative and the positive. And these 2 components, one of them is found in cruciferous vegetables. And cruciferous vegetables like your leafy greens, like your broccoli, kale, cabbage, spinach, collards, things like that. The supplement that is incorporated in a lot of our protocols. And another one that helps to reduce estrogen. So we're finding that people who are adopting a more plant-based diet are getting these things in because they're focused on vegetables, healthy fats, whole grains, and things like that. So they were unknowingly consuming these things and enhancing their fight against the cancer. Wow. So that's the link between like changing your diet and eating a diet. Yeah.
Oh my God. So, like, tell me this: how young is too young? Like, I remember watching a documentary, and some woman, she brought her daughter in because it was in her, the pattern in her family. And she brought her, I think the little girl was around 10 or 11, and they told her, no, don't bring her in. She's too young. How young is too young to bring your child or anybody into, to just start the process of, or getting used to coming in and getting this regularly checkup?
So general checkups, you're never too young for those. But when we talk about like for breast cancer specific, like the mammograms and things, I know in conventional medicine, the promotion is around 40s to begin, like age 40 to begin getting the mammograms. The thing is that we're seeing occurrences of breast cancer at younger and younger age. So that number, that age will have to be tweaked very soon. But usually if you have strong family history or past occurrence of another cancer, you can always start earlier than that. I do have a couple of people that came into my wellness center who were much younger than that and had like advanced breast cancer. And when they found something on the self, they were refused a mammogram because they were not 40. So,
oh man.
So it's always important outside of that to do your own self-check, to learn how to appropriately do those, to ask for, breast exams when you go for your annual physical. If you're not comfortable with the way the mammograms feel, you can opt for other things like thermography if you're not having any other extravagant risk factors that are a little bit less uncomfortable, but can show you something that could be brewing that you can take action on. Things like that. But, that's what these annual checkups are designed for, to catch things early, because catching the cancer doesn't necessarily mean that, you know, we're going to reverse it, but it heightens your odds of winning the fight if we can catch it in an earlier. And for me, you know, being in integrative medicine, a lot of times I'm the last resort for people. So a lot of people come to me because conventional medicine failed them, and now they're end stage cancer. So I have no discretion. Everyone is welcome to come through the doors of the wellness center, and we'll do everything that we can do for you. But of course, just like conventional medicine, the earlier, the better.
Right.
Yeah. So just that this type of medicine exists for things like cancer. You know, we see everything like common cold, allergies, all the way up to autoimmune disease and cancer. So there's always an option for people.
Yeah, because I want to ask you that. Do you have clients that are like doing chemotherapy and trying to do like, you know, your wellness program?
Very good question. Yes. So I do have a handful of the cancer patients who want to do it alongside their conventional treatments, chemo and radiation. I have some people who are completely refusing chemo and radiation and just want to take the natural route. The decision is completely up to the patient. We provide education, and then we just support you on whichever route you want to go. No one is chastised, no fingerprints or anything.
Right.
Yeah. So for people who are doing the chemo and radiation, I guess you would say worst case scenario is that we could help you to bounce back from the chemo and radiation better and more. So the energy depletion is gone, the nausea is gone, the random vomiting, pain, hair loss, weight loss, you know, loss of appetite, things that make you look like a cancer patient. We can curb that, because just like most other pharmaceutical drugs, the chemo and radiation are depleting nutrients from your body. And the main aspect of my therapy is to replenish nutrients in the body, like vitamin IV infusions. We infuse vitamins, minerals, antioxidants directly to your bloodstream. Skip the GI system. We don't have to worry about how well you're breaking things down, absorbing things. It goes right to the cells. You get a burst of energy.
Yeah, because a lot of people, they just worry about getting it out, and then that's the end. They don't come back and try to replenish or to re-energize, refuel. And that's good that they have that you know, way of in coming in the same wellness center and doing all that. That's perfect.
Oh yeah.
Yes. Oh, I love that. I love that.
Now, what's the, okay, I don't know if this is a silly question, but what's the likelihood of a pregnant woman getting cancer or having cancer or breast cancer, or a nursing mom? Is that common? Does that occur?
It does occur. It definitely does occur. Just like there are different types of breast cancer, there are also different locations on the breast that cancer can occur. So it doesn't always have to be the traditional lump that someone feels. There can be things happening in the ducts, like where the milk travels through the nipple. So sometimes we see those, you know, occur for women. But definitely any like pregnancy does not exclude you from, you know, having a horrible lifestyle and having a bunch of things going on. That perfect storm for a cancer situation. Yeah,
because I'm a breastfeeding mom. Like I breastfeed all my kids. So the first time I breastfed my kid, I didn't know any better, and I felt, and I'm like, what is this lump? And I started freaking out. Went to the doctor, and he was like, no, that's just your duct or whatever. Like, so, but that always ran in my mind, you know, for years. So I finally got to ask that question.
Oh yeah. That was a good question. No question is stupid. I promise you that. Yeah.
Oh yeah, that would scare me.
Yeah. Oh yeah.
So Kat, with awareness, can you tell us some of the, like the, I hate to say signs, this sounds so scary, so like types of symptoms that you can tell? Because I know other than the what's it called, the actual feeling it, what am I looking for, the actual
like the lump feeling.
Yeah, the lump. Yeah. Other than that, are there other ways to tell that you know, may be coming down with anything, or?
Cancer wise, just specific to breast cancer?
Breast cancer, yeah.
It's usually the lump is the first, one of the first things that people notice as being off, because unfortunately, cancer is not always one of those things where it's like, oh, I have the sniffles, or
right,
feel like, you know, something's wrong. Some people are operating, feel totally fine, and then boom, all of a sudden, it's like a diagnosis of exclusion. Like, we've tested for all these other things and it's coming back negative, so let's check for cancer, and it comes back positive. Or a lingering cough and then it turns out to be lung cancer. Like something, it's not like so gloom and doom, like, you know, it's cancer.
Right.
Again, going back to making sure you're up on your physicals and blood work and health checks and screenings and the self-breast exams. And the 5 pillars of the lifestyle, as you get those fortified, you'll actually become more in tune with your body and start to notice when things are off. And you may not know what it's called or what box to put it in, but you know that something is off. And sometimes that's enough for me. Like when a patient is just like, I just don't feel like myself, but the tests keep coming back negative, I will still take action because you know yourself better than I do.
Right.
You just really honor and respect your own intuition, honor and respect your own body, get to know your own body, get to know when things are different, inspect everything, look at everything. When you use the bathroom, turn around, take a look, what color is the urine, what, you know, like it's yours. Don't be ashamed. Right. Don't, you know, really, get in tune with your smells and things you're secreting, and, you know, just so you know when something is off, you can, in the early phases, take action on these things before the giant lump develops, or, you know, whatever it is that we're looking for occurs.
Okay. Darius, you back?
I'm back.
There we go.
I was talking. I was. I muted the phone.
We were looking at you. You just wasn't saying nothing.
No, you know, I can talk without words coming. So, is it true that when you do a self-examination, if you feel a lump, is it painless? No. Does it hurt? I can't remember which one it was. Like, there's no pain when you feel it?
It could go either way.
Oh, okay.
And sometimes even that is part of the indicator if it's benign or malignant for like practitioners. But yeah, it can be painless, or you can feel a discomfort when you touch it. Usually there are little characteristics that we look for when we're actually performing it on someone. So something like if you're feeling it and it has smooth, round borders versus like jagged edges.
Okay.
You know, that is like another criteria that a lot of practitioners use for kind of giving you a hint before the actual biopsy of whether or not it's cancerous or non-cancerous. So the smooth is usually more of the non-cancerous. If you're able to move it, like you can push it under the skin and move it, it's usually like non-cancerous. If it's, like I said, jagged edge, rigid, stuck, fixed, hurting, inflamed, dimpling the skin, then that's usually like red flag, like, you know, you need to take action.
Yes. Wow.
Well, let me ask you this, Dr. Kat. So if anyone were to think that they were having some kind of issue or something, or they just need a checkup, where there are times where they may go to modern medicine because maybe they're not sure about the mind, the body, the Spirit Wellness Center. What is the biggest misconception about your therapy and what you do that maybe you can help them overcome, maybe dismissing, the powers that you present?
That's a great question. I have so many. No. Hey, one annoying one is like, I really feel when I use the term holistic or natural, people think that I'm in the wellness center, like cooking up herbs and
right.
Oh my God.
I can only imagine.
with the little voodoo doll and like,
right, yeah.
Oh my God.
What?
Exactly.
Yeah, even that type of party.
So no voodoo, right. Okay.
So that may be one of the main ones. Like a lot of people take it seriously and they feel like it's not something that can be used for serious health conditions. And they're like, oh, I'll get buff in the gym. I'll take supplements. That's holistic medicine. But like if I have cancer, no, that's too serious for this. But
I know that is annoying.
It is. So to squash that, I always explain to people my wellness center is integrative medicine. So that means with conventional medicine, I integrate natural healing therapies and holistic wellness as a goal. So we kind of draw from the best of both worlds because I'm not anti-conventional medicine. So I'm not like 100% one way or 100% the other way. I feel like there's a time and a place for both. So if you're in an 8-car pileup on the highway, not exactly the best time for supplements. We need to maybe airlift you to an ER, something like that, or you have a raging staph infection, you might need antibiotics for that. You're not going to really respond to the oregano oil and coconut oil. So, appendix is about to rupture. We need to take that out to, preserve you. So there are cases like raging infections, surgeries, emergency, and where conventional medicine prevails. And then pretty much everything else can be natural realm. And what I tell people is with it being integrative, all of the natural things that are utilized are things that are actually like scientifically documented and researched. So everything that I use, you can Google it, you can look it up. People have talked about it in their articles, WebMD, WHO, NIH. You can look up high-dose vitamin C IVs for cancer and get all of the articles. So it's not like a random collection of herbs that we're in there putting together for each person. Like these are things that have been streamlined and carefully tried and documented and tested. So the truth is out there and the results are out there. The testimonials are out there about the efficacy of these therapies.
Well, let me ask you this, because when we talk about natural medicine, I'm trying to figure out how to ask this. Okay, your clients, what age range are your clients? Like, do you get older clients, or are they like middle age or younger? Because I ask that because sometimes I can present some natural stuff to my grandma, and it's a little easier for her to go to her doctor and take. Sorry, mama, but to take a lot of these, prescriptions.
Yeah.
So, do you have willing older patients? I mean, you have to talk about them, but I'm just saying.
No, yeah, I do actually. I know exactly what you mean though, because the longer you've been on this earth, the more invested you are in a certain way of being and a certain way of treating yourself medically. So it's hard when something else new pops up and it's like, try this. And it's like, I've been doing what I've been doing for 30 years,
Yeah.
But the older clientele I do get, majority of them come to me because I'm helping them manage their hormones. So
Okay.
at the Center, we do bioidentical hormone replacement therapy. So for men and women. And so when people see the magic that happens when your hormones are balanced, then it's like enough said. Like, help me with this, and the, all these other things also, because you took away my hot flashes and you gave me my energy back, my sex drive back. For the guys, my motivation, recovering from workouts faster, I'm building muscle, things like that.
Oh,
and
wow.
then, because everything is really connected, so usually when people come in complaining about one thing, we find the actual underlying cause in the spiritual category, doing like hypnosis or timeline therapy. And it's not always just change your diet and here's some supplements, So usually deal with one complaint, we actually kill like 7 complaints at the same time, because the entire human body is connected and we can't isolate systems the way we've been trained to do so far.
Right.
You said hypnosis.
How do I get in on this?
I gotta. I can't let that one just
No, he's
fly
not.
by.
He's like, no.
Are we talking like hypnosis like I see in the movies? Hypnosis? What is hypnosis? What's really hypnosis?
So medical
like, have people barking like a dog?
No. So medical hypnosis is different from entertainment hypnosis. So no barking like a dog. We're not sending people to the sunken place. Not doing that.
I was about to let you know I needed some help with that.
I know. I always have to tell people that it's actually a very effective mechanism for accessing the subconscious mind and helping you to willingly enter into a trance state. So you're fully conscious, you're fully aware, you're fully consenting, you're just in a trance state, which we all put ourselves into trance all the time. So, like when you're driving home from work and you pull into the driveway and you're like, wait, how did I get here? Or like, I don't remember past the stop sign. That was a trance state. Or
we're under hypnosis all the time.
All the time. Or like, when someone is like, hey, I've been calling your name for like the past 20 seconds. And you're like, oh, I was so into the movie, I didn't hear you. Right. That's like trance state. So you're not like unconscious, you're very aware. So help you get into that state willingly, and allowing the conscious mind to relax and the subconscious mind to be exposed. And now suggestions can be implanted in the subconscious mind. So it's very effective for people who want to break a habit, like stop smoking, for instance, or stop eating too much bread, or people who want to remember something in their past that their mind just blocked. The conscious mind is blocked as a protection mechanism. A lot of times people who just want to be more like positive things, like I want to not procrastinate so much, or I want to plant suggestions of positivity, things like that. So very, very effective tool. A lot of times we create aversions for people who want to stop doing something. So an aversion for, like during pregnancy, when all of a sudden you can't eat something anymore, that's called an aversion. So for instance, I want to stop eating so much bread. We can ask you, well, what do you really hate? And we can pair that and with the bread in your subconscious, so that when you think of the bread, you think of that other thing that you hate. What? You're at Olive Garden and you're like, I'm cool on the breadsticks. I'm okay. I'll pass. I'm okay.
Yeah, that's what I did for my last pregnancy. I did like this hypno tapes or whatever, or CDs or whatever.
Yeah,
just to have a nice calm pregnancy or whatever.
Oh yeah, no, I did them too. I did the same tape. Yeah, yeah.
Yeah,
Pretty
so
cool.
it's it's effective. So
Is
Yeah.
it?
Your mind is very powerful. And
right.
when you realize like how powerful it is, first of all, and then when you start to learn how to use it, my goodness,
Mm.
you can use your mind to get yourself out of disease even. And
And I hear that all the time.
yeah, like it's very, very powerful. And I'm sure everyone is familiar with like the law of attraction is
Right.
secret. That's basically what it is. Like our universe is attraction based. So whatever you put out is what you get back.
Coming.
Right.
So even if you're focusing on something not happening, the fact that you're focusing on it makes it come.
Ooh.
So that's why I said in the beginning, let's switch from cancer awareness to wellness awareness.
Yes.
Right.
Focusing on wellness so that we receive wellness. Because when we talk about breast cancer awareness,
Mm-hmm.
we're actually bringing more of the cancer, if that makes sense.
There we go.
Got you.
Or like when
Okay.
we have these
All
wars.
right. Okay.
Yeah, we have these wars in the United States, the war on drugs, the war
Right.
on,
Yeah.
we're focusing so much on the drugs and violence, it's actually perpetuating it.
Right.
Ooh.
We
And
had,
I'm pretty sure they know that themselves. That's why they
Yeah.
probably.
I mean, if we had a campaign on peace instead of the war on
Right.
violence,
I
you see,
got
like changing
Yeah.
the lingo and attracts, more positivity towards us.
Right.
Yeah.
All right, all right. I like that.
That's a great outlook. I like it.
Gotta switch around. Well, Dr. Cat, we really appreciate you hanging in there with us through these Google issues and dropping some knowledge with us. I know you're online. You've got the Mind, Body, Spirit Wellness Center online. Where can people, if they want to learn more about what you do, how can they get in touch with you on social or through email, phone, pigeon? How can they get in touch with you?
So the easiest way, in an effort not to list all of these platforms, the easiest way would be to just hit the two websites, and then from there you can access all of the social media platforms. You can subscribe to the newsletters, so you always receive personal invitations from me to events and things around the community. So again, the Mind, Body, Spirit Wellness Center is the actual physical, like brick and mortar, where you would come if you want to receive treatment. And we can serve as your primary care facility if you want a primary care practitioner that's into more holistic ways of thinking and natural ways of thinking. So that would be mbswellness.org. And then to learn more about me personally and read my personal blogs, see my events around the city, the state, the country, you can go to my blog, Returning to Nature. So that's just simply returningtonature.com.
Bam.
We're
on Facebook, Instagram, everything. Yeah.
Man.
All of that.
I wish you were over here, man. I wish you were over here.
And I wish I was still in Atlanta.
I know. And I do have some remote stuff that I can do for you guys. You may not get a lot of the therapies like the IVs and things, but we can at least do like wellness coaching and supplements and enhance the lifestyles that we can do like, virtually. Yeah. And then these things, the podcast.
Right?
There you go. I dig it. So it doesn't matter where you are. You don't have to be in Atlanta. You can hit her up. She'll kind of coach you through your life, get your wellness in check. This has been an interesting episode number 10. We're getting on and popping. We thank everybody for joining us, Dr. Cat especially here, and we'll be right back here next Sunday Night Vibe. You can catch us on all the major platforms from Instagram to iTunes, to Google Play. We're all over the world here. And ladies, anything else you want to say before we call it a night?
Oh, Kat, I just want to say thank you so much. It was so fun. I always try to catch your webinars and stuff. And I'm always there front and center. I'm like putting it up like everybody, please because the information you give is so golden. I cannot tell you that enough. I thank you so much.
I appreciate the support. I really do. Thank you. I gotta get out there too. I gotta get out there. Yeah, I really do. I'll do an event just for you guys.
I'm excited.
All right. We will see you next week. Thank you for joining us.